Patients that are referred to physical therapy with a complaint of dizziness usually fall into a few specific categories that we are very effective at treating as physical therapists. The first is something that many of us refer to as vertigo, and some people describe as spinning, and we as physical therapists refer to this type of dizziness as BPPV, which stands for benign paroxysmal positional vertigo. And it's usually thought to be due to debris which is collected within a part of the inner ear. This debris can be thought of as ear rocks, if you will, although the formal name is otoconia. These ear rocks are small crystals of calcium carbonate that come from a structure in our ear called the utricle. The utricle can be damaged by head injury, infection, or other disorders of the inner ear, or it may have degenerated because of advanced age. We are very effective after a thorough examination at treating benign positional paroxysmal vertigo here at Balance Physical Therapy. Other sources of dizziness, of course, are cardiovascular, sometimes known as orthostatic hypotension, which is an acute or abrupt change in our blood pressure because of a change in our body position with respect to gravity. You can think of this as the noise during the night that startles you and you shoot out of bed really quickly, land on your feet, and suddenly find yourself stumbling forward. I think we've all experienced that at one point or another. Well, your heart has to create some more pressure to start driving blood uphill toward your brain, and it takes a second or two for that to be accomplished. And as we get older, these time lapses with regard to blood pressure and with regard to the otoconia crystals in our inner ear being able to do their job takes a little bit more time. So most of our dizzy population is of an advanced age, but not always. Dizziness can also happen because of athletic injuries, blows to the head, post-concussive syndrome, etc. And symptoms of dizzy people are not just related to dizziness. Sometimes they can include lightheadedness, imbalance, nausea, or what patients describe as, quote, feeling foggy. Now, as a physical therapist, we have a limited scope of tools available to us. I can't send you down the hall to have a CT scan of your head, but what I can do is spend an hour thoroughly evaluating you, taking a complete history, and through a series of carefully applied tests and measures, decide whether or not you are appropriate for physical therapy based on your complaints and your history. So, if you're dizzy, if you think you have vertigo, if you think you have a history of something that is making you just a little bit off what you would call your center, well, come and visit us, and we'll decide whether or not we can help you and get you back on the road to feeling steady and solid again.